Well, here we are again with Dr. Archer L. Irby, and I'm so sorry that his wife, Randy, isn't here because you know she's a chiropractor too. Am I saying it right again?
That's correct.
Okay. But remember when we spoke about this before, and it was just a dream or something we were thinking about, right?
Just thinking about it. That's right. That's pretty amazing because we say a lot of things, even as people. It's human nature to be all talk and never follow through. Then there's also things you can talk about things and things happens or it doesn't happen. When we spoke of having a place out in Brooklyn, it was just to me. I like, okay, all right, I'm gonna be out in Brooklyn, and I'm all the way out in Manhattan. I'm gonna be all the way out in Brooklyn. It's just too much. At least I thought it was too much, but you never know.
We spoke it into existence, right?
Yes, we did. We spoke into existence, and the more we spoke of it, it became more of a reality than the. Just like with anything, you have to pray about these things. You can't. To me, I'm a firm believer of prayer and just making sure that it is that is okay with Almighty God first, and then He will lead and direct my path. So. When we spoke of it, yes, it was a beautiful thing, and now that it's here, it is made into reality. Oh, it's a wonderful thing because it's always good to bring chiropractic and to expand what you know to the community at large.
Well, you know, when we speak of bringing things into existence, we both realize about the Lord. And when people say, why did you say that? And a lot of times you said it and you didn't realize what you said. And I told you, I said, I hear that you might be coming to Brooklyn.
Yeah, you know what? You also say be careful what you ask for, too.
Because you got it. You got it. Now you have, yes. You're in Manhattan. You know he's at 99 University Place on the 6th floor, and now
I'm at 1222 East 96th Street in Brooklyn, New York, and it's with the Gracie family practice. I'm here with Dr. Bernadette Sheridan, who has opened up her practice to me to have a space in order to service the community through chiropractic.
Right, and will your wife, Randy, be working here also?
Yes, when she's not taking care of that now, that 7-month-old now. Remember back in the first time we spoke, he was just a little old thing. Now he's 7 months. He's crawling. He's standing up now. It's a beautiful thing, you know, watching a kid at 6 months, 7 months, and he's crawling already, standing up. But I think you can find that through a chiropractic baby. But she's at home taking care of him, and when she has time, like when the babysitter and can keep the kid or watch our son, she'll come out and practice it as well.
Now tell me, how many days are you in Manhattan and how many days are you in Brooklyn? And also, would you give us the hours?
Certainly. My office in Manhattan, which is located at 99 University Place on the 6th floor. The office hours times is Monday, Wednesday, and Friday from 10 to 7, Tuesday from 3 to 7, and I'm here in Brooklyn one day a week right now on Thursdays from 11 to 6. That would probably change. I'll probably be moving to 2 days pretty soon because the overwhelming response has been just overwhelming.
Hallelujah! Praise the Lord.
So
we prayed for this.
Yes, we did. We prayed for a way of people to gain a more better optimal lifestyle through a more holistic way that they can be educated and learned that health can be achieved through the 5 aspects of health, which is proper nutrition, adequate sleep, exercising, positive mental attitude, and of course, being nervous system free by the chiropractic adjustment. So with that in mind, I'm out here teaching people like I teach my clients or my patients out at 99 University Place about health, that health is a state of optimal social and mental well-being without nearly the absence of disease or infirmity. So that concept is catching on. It's a catchy tune, you know, but it's such a true statement, and people are definitely responding to that type of lifestyle. And also we do health tips of the week. I have incorporated a lot of things that again, like I do health, but this week has been lifestyle changes.
I see.
And vices. And so a lot of people think that, oh, if I just have a little cake here, it's not going to hurt me for this day. But think about it. How many times are you saying that in 30 days, a little cake is not going to hurt me?
What about 5?
Well, 5, but it can be 5 times in one day. Some people actually eat sweets on an ongoing basis, and that it keeps their body system in the sugar shock, and that they need proper chemical balance. So we need to have things in more moderation, and because it will affect your nervous system, and then you'll be seeing myself and also Dr. Sheridan. And but the reality is, we want to get people well. We want people to stay well. It is not my practice to see a patient, nor I think it's Dr. Sheridan's practice to see a patient for forever. You know, you want to get them to be able to take responsibility for their own health.
Well, I really enjoy visiting both of you. The way I'm doing, instead of being laid on a table.
Yes.
But I also heard that you joined a church since we spoke last. That was in August, right?
What church? Well, it's only the largest church here, probably in the state of New York. If you don't know, you should know, because it's under an incredible leader in the community, a shepherd, Dr. A.R. Bernard, at the Christian Cultural Center, which I'm proud to say that I'm part of. Gravitating towards such a large congregation as the church congregation is a quite of a commitment on anyone's part, but you have to think about the message and what you are getting in the teaching. So I joined Christian Culture Center, which is right up the block, and it's also and it's good for me, because coming from where I live, and on my way home, I can stop in on the bookstore and pick up some things, and pick up some taste or where I need to meditate for that day. And
Well, I'm gonna see if I can get Dr. A.R. Bernard to come and get an adjustment.
With my doctor, you have 2 large services in the morning. I tell you, it must be very tiring.
He needs it.
He needs to be adjusted.
That's right.
Absolutely. He's up there, and
Well, maybe, who knows? Maybe he does get adjusted.
maybe.
You know?
But if not, I'm right down the block, and I would definitely take
Right.
it faster.
So now tell me, how have you found working in Brooklyn to be?
I found working in Brooklyn almost just like home in South Carolina. Yes, Brooklyn is a special place. I love being out here. The people are incredible. A lot of culture. Just the whole environment. It definitely reminds me of home. There's a lot more communities. You can see people out, the kids playing in the play yard, in the backyard, something that I'm really used to. Coming from South Carolina, there are no farms here, or at least that I'm not aware of.
There are some
They are?
farms,
Okay,
yeah.
well, that's what I said. Where Brooklyn's like South Carolina
right.
a little bit. So I really enjoy being out here and serving the community out here.
Well, they always did tell me that Brooklyn was like the country. But they did. They used to say that.
Used to say that?
Brooklyn was like the country. But the people here are from everywhere. But I find the people to be very nice in Brooklyn.
They are. They're very nice, and they are proud folks. Just proud. Where you from? Brooklyn. You know.
That's what they say.
That's what they say.
Well, I would know about.
It's your signature. I'm like, okay, I'm from South Carolina.
Well, I know a tree they say grows in Brooklyn, so I don't know anything else.
Definitely.
But have you? When did you start here?
I started here back in February, the 1st of February of 2003. I'm still, like I say, launching the practice and accepting new patients, and we have started to do health classes, which our first one is going to be next Thursday. I'm going to be doing health classes here at 1222 East 96th Street here in this office. The first one will be March the 14th. I welcome everyone who have had an interest or thought about coming to a chiropractor and being under a medical facility that welcomes holistic health care. Come and get some knowledge and some understanding as to what a chiropractor does, and so that we can so I can help explain or answer any questions that you may have.
Well, are you planning on having this monthly or once every? How often?
This is going to be twice a month right now, and I like to hold these meetings weekly. I hold health talks in my own practice out in the city weekly. And I find that the more educated a individual is about their health, and the more they're made aware, those are the ones that have a tendency to get great results and to maintain wellness. And that's why I hold the health talks as often as I do, and it's not all about you're not going to hear about chiropractic all the time either, because sometimes it's different things, different subjects. It can be about your digestive system, or it can be even about some things that may be affecting you, maybe like some arthritic type of conditions, and then I can probably help to explain the holistic way, and then Dr. Sheridan will come in and talk about the allopathic way and how we can help to.
So you all are more working hand in hand.
Absolutely.
And you also have Miss Frosky?
Yes, Miss Frosky, Miss Sabrina Frosky is the nurse practitioner here,
right.
And Miss Patricia Tolick is the nutritionist here, and right now we work hand in hand. We feel that this current healthcare crisis which we are in needs to be changed. Just the whole paradigm needs to be changed. We need to be looking at all forms of healthcare avenues in order to get the patient well and to maintain wellness. It's not just that chiropractic is the end-all cure-all or medicine is the end-all cure-all. You need it all, because there are limitations. There are limitations in medicine. There are limitations in chiropractic. But what we need to do is pool our resources. That's where, in our opinion, as the reason why we are here, which I think that we are moving in the forefront of what health and wellness should be, by providing these type of services in the facility in order to get the patient well and stay well.
So I also hear that you're going to have a podiatrist here also. So this is wonderful. Everyone under one roof.
I've heard talk about that, and I know it's coming into existence. Yes, a podiatrist is coming, and that's great as well, because when you talk about the biomechanics of the body, when your feet are not as I guess, your feet are flat, we call them flat dogs, flat foot, or something like that. It will affect your knees, affect your pelvis, and eventually, well, not eventually, it will affect your spine. And if left untreated, or such as if you don't have the right orthotic or heel lift, you will have some musculoskeletal problems eventually.
Well, I know because I had at one time, it came very suddenly, heel spurs. And the heel spurs affect the way you walk because you're leaning towards one way. But then I came to you and you adjusted my back or whatever. And people should be educated on this, because people say, oh, they're the ones that crack your back. No, you don't crack my back. I don't want anybody cracking my back. Right. You must be kidding.
I don't want anybody cracking my back either. No, I want someone adjusting my back or making the right spinal corrections. That they're licensed, a licensed chiropractor.
Yes, you and your wife both
are licensed chiropractor, and I don't know if the community knows that chiropractors go to such great stents to become licensed. Here, especially here in the state of New York, I myself have compiled over 2,500 classroom hours and spent several academic years and also pursuing continuing education, just in order to be to be up to date here for the state of New York. And I guess that's good, because as a doctor, you have a responsibility. You have a responsibility to keep up with today's current health trends, and in order for you to provide the latest and most effective care to your patients.
Now, that's the same thing, like they say, well, the doctor's not in now. She's away on a conference, or the doctor, whoever. Well, they away. What you mean? They have to go. You have to go and learn new techniques.
Absolutely.
Correct? I do not want a doctor that never, even if you're going on vacation, let me think you're going somewhere to learn something.
Wouldn't it be something if, let's just say, if the allopathic medicine, the allopathic doctors were still leeching people or putting leeches on into the blood,
yes,
so to get the
go ahead, tell me the story about
to
that.
get the disease out.
Yeah.
I know you put a leech on. They used to put leeches on to suck the blood up, because they thought that bloodletting would get the sickness out, the poison out. Imagine
what
if
did the leech do?
Well, they suck the blood, suck their blood.
And how many leeches? That's really true.
Yeah, it's really true. How many ever they thought it was necessary?
The ones that were putting, they had something that they put your head on, and tightened it. Now, what was that? To get the demons out of the brain.
Yeah, there are a lot of medieval.
That's what it was.
Or practices, whatever. Medicine has definitely come a long way, and so has chiropractic as well. There are instrumentations that we use as chiropractors now that help to aid in the effectiveness of the chiropractic adjustment, such as the medical advances we have come a long way. Something that's of arthroscopic surgery in terms of a shoulder injury or something like that. So advancements have to be made. But if we were still practicing the way we were doing that years ago, then
because at one time, I remember when different insurances did not cover because they did not believe in it.
Right.
Well, who was knocking it then? The doctors?
Right. It was a lot. We got a lot of resistance, especially I think stemming back from my first conversation, we were talking about D.D. Palmer and the
Right.
first chiropractic adjustment, and how that was over 100 years ago. And yes, the American Medical Association has put up huge resistance to anything that may go against the practice norm of conventional medicine. I throw my hats off for those individuals that has maintained a open mind, that they are looking for other advancements and incorporating other forms of healthcare, especially chiropractic, to order to get the patient well, because it all stems back from the patients. And yes, insurance companies were not covering chiropractic, mainly because of probably because of resistance from where they normally get their money. That's the drug company or
That's right.
or whatever. So, but we as chiropractors let our patients do the talking for many years. People have found that they have gotten greater results by going to a chiropractor, or improved results by going to a chiropractor. Most of the time, around say 90% of the time, when an individual walks through my door, they have been all the way around. Anyway,
The world,
yeah,
right?
yeah, the world,
Different medicines.
and different medicine. I already know that even before you even step foot in my door, I know where you've been. It's very few individuals that have started with chiropractic, and that's it. Normally, when a person reaches a chiropractic office, either they have been in some type of accident, or they have had some type of debilitating disease, and that they're just trying to look for, hey, just help me, doc, save me, doc, let me try you now.
Right.
So my the message today, like the patients have been our biggest advocates, and now most insurances covers chiropractic. We still need insurance parity when it comes to proper compensation for similar services being performed by the chiropractor and the medical doctor. That arena needs to be addressed, especially probably like in workers' comp, no fault, or major medical insurance plan. I would urge everyone to check your plan, and if you do not have chiropractic coverages in there, please, when it's time to come to re-enroll or in a plan, either
Find out why.
find out why, or and go to one and find out how many visit one is allowed. I would like to think that a day will come whereas chiropractic care, you will have unlimited care.
Right. Eventually
it is cost effective to come to a chiropractor. It's less than having surgery done to your back or to your neck.
Right.
It's not that, and I'm not saying that I'm against surgery or anything like that. I just think that individual probably should try
Make that your last resort.
non-invasive first, and making your last resort. Surgeons do a wonderful job, but try something non-invasive first, and if it doesn't work, and with the proper consultation with your chiropractor, with the orthopedist, or with the neurosurgeon, go for them. Make an informed decision about your health.
Well, I know I would try a chiropractor or anything before I would want to be cut.
Cut on.
That's true.
Because you're never the same.
You're never the
You're
same.
never the same. But sometimes surgery is definitely necessary. I'm just saying chiropractic first, and let us all be health conscious and be made aware, and let's live a more optimal life. As you get up in age, your bones, you start to deteriorate.
Tell me about it.
You break down a little bit. You get some age, you get some pains and stuff, and
And you wonder where they coming from. It's just from being here so long. Is that it?
Well, I'm gonna let you because I'm gonna be there one day, so I'm not gonna touch that one.
You have your bones here? Yeah, you know the bone?
the spine.
The spine?
I have my spine in my back today. No, I don't have the spine with me today. He didn't travel in the snow.
Oh, no.
He doesn't like to travel in the snow for fear of an accident.
But, I'm really happy that you came on board. Well, now we're going to have, we're having Jim's story. And let me tell you something. He's my photographer. And Dr. Archer Irby, who's my son, he's going to be giving him a good, what is it you're giving? Adjustment. Now we're going to watch it here. It should be me on there and Jim talking or something here. But it's very interesting because just like he did Jerry, he's going to do, well, you see, first he does the leg. To make, if you can see it, you could see where they're not even.
Jim, can you turn your head to the right, please?
He's making him turn his head to the right,
Back to the center,
back to the center,
and to the left,
then to the left, back to the center. Boy, I'm telling you. And he's going to the spine.